Hi, I'm Teresa Anderson from Central District Health Department, back again as promised to bring you an update on where we are and what we're doing with COVID-19 in the Central District. Central District covers Hall, Hamilton, and Merritt counties. And so I want to just give you an update of where we are. A lot of things have happened since the last time I spoke with you, and I want to tell you what we're doing in public health right now because we're really looking to coordinate the efforts that are going on within the community. So last week we met with some city council members in our 3 counties and also with county board members to help them get a better grasp on what they can be doing to prevent the spread of the COVID virus and to prepare for it when it comes here. We also put out a number of communications to you in the public so that you would be prepared. And so when we know what we can do, we feel better, I think. So taking some actions to prepare your home, to prepare your family for when we get additional COVID cases here, we'll talk about that in a minute, then I think we get a better sense of comfort as we go through this. Last Thursday, Friday, I think it was, we had a conference with healthcare providers and with the hospital. And if any of you saw that, you would see that we've got some really good coordination going on between the hospital, healthcare providers, the health department, and in the community in general. So that this is a community, this is an area of the country where we do work closely together, and this is going to be very important to us. As far as cases, we have only been able, I think, to conduct 15 tests in the last, well, from the beginning, so that would be at least the last month for COVID-19. All of those or 19 tests, all of them have been negative, okay? But there are some folks who are sending specimens to private health labs, and so those specimens or those results take a little longer to get to us at public health. One difference that occurred last week is through our Nebraska DHHS and through our state epidemiologist, who said, well, he said a couple of things. One of them was that we, as clinicians in our community, the clinicians can start identifying and diagnosing folks as having COVID-19, whether or not they've been tested based on symptoms. So now I think we're going to see more cases. We're not going to see more testing right now. We hope to in the future. At this time, testing is still hard to get. But what we're going to see is our clinicians and our practitioners will go ahead and diagnose someone based on their symptoms. And we do that sometimes with flu. We don't always have to test for influenza to know a person has the flu. And so we're at that point now where we don't necessarily have to have the test. Clinicians are able to diagnose based on symptoms. So I think what we're going to be seeing in the next, for the foreseeable future, is an increase in the number of cases of COVID-19 in our area. And so I wanted to tell you that because you're going to see more of that. We still have the rules in place where we want you to stay home. If you start to develop symptoms, call the clinic. Don't just go in. Don't make an appointment and then just walk in. You need to call them, explain that you think you might have COVID-19, and they will tell you what they want you to do in order to get tested or in order to be seen. I know that several of the clinics now are working on telehealth where they can connect with you by some electronic device so that they can counsel you, diagnose you, and you don't have to leave your home, which is ideal. And I think we're going to see a lot more of that as we move on. We have a plan, and we're working on that plan. Includes right now slowing the spread of the virus. And when we slow the spread, we slow the impact it has on our healthcare system. And as you know, we've been talking about this. We don't want to overwhelm the healthcare system, and we will if we're not careful. Each of us has a part to play, and we need to play it right now. Schools have been out of session for a while, and we think that that's going to probably continue through the end of the year. So I can't speak for the schools. I'm guessing that probably that's going to be the recommendation that they make, or the decision that they make based on recommendations from public health all across the state. We don't want to take 2 weeks off and then send everybody back into the classroom and just start all over again. And now that we know the virus is getting closer to us, it would be much more difficult to contain it. And again, our efforts are aimed at containing it and not letting it spread like wildfire, which, as you've seen in some places, it has done. And so we can do this, we can get through this. We're still continuing to work with nursing homes, we're continuing to work with workplaces to help them know what to do. We're absolutely emphasizing social distancing. Stay away from other folks. We know that some of our bars and restaurants are still open and that they've made some arrangements, but I want to tell you that as it's your own personal responsibility, if you go out to eat, to make sure that you're not coming in closer contact than 6 feet from anybody else who's at that same establishment. The rules are changing. This is going to be the new norm. We're going to have to distance, and we're going to have to take the personal responsibility to do that. Nobody can do this for you. The government's not going to tell you what to do all the time, although here I am speaking to you, advising you that social distancing is essential. We can't enforce it. We cannot have law enforcement at every bar and restaurant, at every other gathering. But what we can do is help you understand that it's your responsibility, and that if you can adhere to this social distancing, we'll get through this with a better outcome. People are worried about going outside. We think that folks who are at high risk would be better staying inside and maybe just opening the window for fresh air, but not going outside because they may come in contact with someone. But there's no reason that you can't take the kids to a park or to an area that's there are hardly any other folks there, and let them play and get their energy out, as kids need to do. But to try to stay away, don't go for walks as a community group. Don't do that. Separate yourself. Talk on the phone when you get home, or FaceTime with your neighbors and your friends, but stay away from them as far as personal contact, and that's going to help us get through it. So going out is okay, out meaning outdoors. Go out, play ball in the backyard with your kids, don't worry about that. But what we know is that person-to-person spread is highly likely because this virus is very contagious. I think that's about all I have to tell you today. I know that you're all interested in staying safe and protecting your loved ones. We want you all to think about, if you get the virus, what steps would you take to isolate yourself from the other folks in your home. We want you to think about, if you get the virus and you don't have any symptoms, and you go visit grandma or grandpa, or you go visit someone you know has an underlying health issue, that you may be setting them up to be extremely sick. So it's up to you, it's up to each and every one of us to do our part. I'll be back next week to fill you in with more. Take care, wash your hands, sneeze into your sleeve, get plenty of rest, get some physical exercise, and do something that relieves your stress, whatever that is. And I'll see you next week. Thank you.